Hello, welcome to my website. My name is Dr. Gauri Bhide, and I'm a medical oncologist, which means that I'm a doctor who specializes in treating and taking care of patients diagnosed with cancer. I was born and went to medical school in Mumbai, India, and then I immigrated to the United States. I did my fellowship, which is a training after residency in oncology and hematology in Boston. And then I stayed in the area for the next 25 years. I have worked in a variety of settings, from university hospitals and large tertiary care cancer centers to community hospitals and community cancer centers, the rural Midwest, providing rural oncology care, and have also had the privilege of shepherding and helping close friends and relatives through their cancer journey. When they were diagnosed with cancer, I accompanied them to their oncology appointments as a friend, and I was able to understand or at least observe what patients go through when the doctor is talking, and I was able to bring that lesson to my own practice. I have found that when people get a diagnosis of cancer, uh, in almost a self protection manner, the brain just shuts down and freezes because your life has been changed and everything is upside down. You may get this news either on the telephone or you may be sitting in your primary doctor's office, and the rest of the conversation takes place in a complete fog. Hopefully, you have someone with you who can listen to the rest of the discussion and be able to help you digest it and understand it after you leave the office. When I accompanied my friend, I found that even though she was asking appropriate questions and nodding intelligibly, when we came out, I discovered that she hadn't actually followed the entire conversation. So, how can you fix that? One way is to take people with you, close friends, close relatives, your support system, and have them be a second pair of ears and be able to discuss this after taking notes and asking good questions when you are consulting with the doctor. Another possibility is to ask if you could record the conversation and then be able to listen to this conversation afterwards and be able to digest it. Sometimes it takes weeks to months to understand truly what has transpired. The words that are used in the medical language are not what they mean in the English language. And that is really very confusing. And what happens is when you hear the word cancer and your brain shuts down, when you go to do a web search, you're basically doing a web search on the title of what you've been given. If you don't know your stage or your grade or any other details of your diagnosis, what you read on the web may not be relevant to what your particular situation is. It's been my passion as a result of all these interactions to make sure that my patients understand what they are going through. And I try to speak words which are clearly interpretable. I make sure that they have the opportunity to ask questions, and we have follow up visits where we go over the information again. In order to reach more people and decrease the anxiety of both facing the diagnosis and making treatment decisions, I've also written a book which is called Diagnosis Cancer: What Happens Next? And it takes you through the entire process step by step. It doesn't actually prescribe the treatment, it just explains what you're going through, what tests you are going to have, for what reason, what information they're going to gather, and what consultants you're going to meet with, how they will confer with each other, and how treatment recommendations are made. If you are a good participant in this discussion and understanding, it will decrease your stress and anxiety about facing the treatment, and anything that will decrease stress will help improve your treatment outcome. In this book, I also address other support systems that you may be able to avail of, what other ancillary measures you can take, like diet and exercise. Some people benefit from meditation, other alternative treatments, or I rather complementary treatments like acupuncture can also be helpful. So, please do avail of it if you have a chance or if you have a need. I'm told that a lot of patients have found it very helpful, and I've got this really fantastic recommendation from Dr. Bernie Siegel, who's a well known patient advocate and physician. So, it is available on Amazon, and I also blog on my website, which is www.gauribhide, GAURIBHIDEMD, that's all one word, .com. And I tweet, and my Twitter handle is at GauriBhidemD. That's also all one word, GAURIBHIDEMD. So do follow and join the conversation. I wish you well on your journey. I'm happy to help anyone who wants to reach out, and good luck to you.